Hello, and my name is Dr. Craig Selinger, chiropractic physician, and I am your host of the Injury Podcast. Welcome back. Today we have a great episode. We're going to be talking about a topic that a lot of people have heard about. It's related to peptides. Peptides being used by people to help with a variety of different conditions that they have, that they want help with. Now, and it's also a little controversial, which we're gonna talk about as well today. But before we get into that, I just want you, little disclaimer, this podcast is for educational purposes only. It does not constitute medical advice, or it does not constitute a doctor-patient relationship. Always consult your healthcare provider before starting any treatment. And I have an excellent guest with me today, Dr. Mikhail Berman. He's a medical doctor that specializes in functional medicine. He's also internal medicine. He's been doing this for years, has a wide experience, and we're going to be speaking with him today about peptides, their use, and how he sees patients in his practice. Dr. Berman, welcome to the practice.
Thank you for inviting me.
Podcast, I should say. You find the studio okay today?
Yeah.
I know you're coming down from Palm Beach Island there and so forth like that. So peptides, just simply put, what are peptides? Is it like a steroid? Is it a cream? Explain a little bit about what it is.
Well, peptides is molecules that are made of short chains of amino acids. Everybody knows protein.
Mm-hmm.
Protein is about 70% of the dry weight of the body. And the proteins, being very big molecules containing thousands and thousands of amino acids, they, due to their ability to fold, they are performing like biochemical machines that do different functions. Building the other proteins, doing some chemical reactions on the other proteins, and catalyzing reactions. So it's a biological machines.
Okay, great.
But they are consisting of these very simple molecules called amino acids. There is only 22 of them, I think, or 20 of them, that make all the proteins in the body. So the short chain, they can make the chains that are too short to be folded, to form as the proteins, are called peptides or polypeptides when they grow a little bit longer.
Okay.
So the example of the peptides are such as hormones, for example, like insulin, growth hormone, oxytocin, mostly the hormones that are produced in the pituitary gland. In opposition or in contrast with, for example, steroid hormones that are derived from cholesterol.
Okay. So they've been in the news lately a lot. And I know that there are peptides, it seems like, for everything. And I know that there's been some controversy with possibly some interest in the pharmaceutical industry that wants to stop these peptides because they've been, I think, pretty helpful for some people. They have peptides that can help your skin. They have peptides that can help sleep, right? What are some of the more common conditions that people use peptides for that you see in your practice?
Peptides could be synthesized and could be targeted to do certain functions. It's like a key to the lock.
Okay.
part of the hormone that would be, or signaling molecule that will send, that will connect to certain receptor on a cell. And because it's very easy to synthesize, you just connect several amino acids in a certain order, and there's your peptide. So you can take a little part of the hormone, like a growth hormone, or you can take a little part of the protein and actually create a peptide that will target certain function in the cells.
Okay. So on this,
You can do anything practically that could be affected the cells. It's
okay.
engineering.
Wow. So on this podcast, this is called the Injury Podcast, and our audience are people that are interested in recovering from injuries, learning more about this. And I know I've heard of this peptide called TB500,
Right.
and that it might be helpful in healing. Have you have you heard about this peptide and the effectiveness of it? And have you? I know it's
Well, there are two peptides, more than two peptides, but I like two peptides that would be very helpful in application to healing and the structural issues, which is a BPC-157 body protective compound 157. It's a 15 amino acid peptide, which is a signaling molecule which makes tissues, especially the connective tissue like ligaments, tendons, cartilages, to repair itself. And speaking about TB500, returning back,
yeah.
TB100 is just a part of a BPC-157.
Okay. All right. And was there a recent legal case where there were I heard seven peptides that were made legal, and before they were not as legal. There was some controversy whether or not you could use these actually. And I think BPC 157 and TB500 are okay for people to use. They're not approved. Maybe I don't know if they're approved by the FDA, but they are approved for use in some situations.
Well, I'm not a lawyer, so
I know
I'm not giving legal advice, but the situation is like that. The first peptide that was actually invented or discovered was insulin in 1920s, I think in 1921 or 1923, which is a peptide.
Right, okay.
And the research in a medical application of a different peptides started actually in my hometown, St. Petersburg, by the guy who is approximately my age, Dr. Vladimir Kamenson, who started the research and who was actually nominated for Nobel Prize for the research of peptides. And in Europe, there is 40 or 70 peptides that are in use and wide use in Australia and Europe and Asia. In United States, it was approximately, I would say, probably about 10 years ago, maybe 12 years ago, that the first talk started. Not the first research. Research is going on. More research in Europe, though.
Right.
But we had, I think, 12 peptides that we were using, which were compounded for us in compounding pharmacies, by the compounding pharmacies. And people loved them. They were very effective. But 2 years ago, in 2023, the regulations became different, and compounding pharmacies were not prohibited to compound the peptides, but they were prohibited to compound the peptides from the available source.
Got it. Okay.
So they can compound peptides all they want. The only thing they cannot use the source,
Right. Right.
the available sources.
Okay.
So a lot of peptides appeared on the market that were actually not for human use.
Right.
Peptides, I don't think that they are under the FDA jurisdiction for the simple reason that they are naturally occurring compounds. You cannot patent a potato.
Right. Okay. So that's important to know. So,
But somehow they've been pushed through the FDA, like a peptide like bremelanotide, which is PT-141, or recently they put through tesamorelin.
right. So these are natural occurring molecules or compounds that are not able to patent. So pharmaceutical companies have to they have to come up with and patent a synthetic type of drug, and then from that, as long as it's different from what the natural one is, then they can't disturb that one if it's naturally found in. And then it, like you said, then, but it's
find a way to.
It's controversial. So but what I think is interesting is that people have been using these, and many people have been getting good results.
Excellent results.
Yeah, very good results, and it's a more natural form of treating the body and treating conditions rather than other medications and drugs, so forth. So, I mean, maybe. I mean, that's what we're here to learn more about, and I'm learning as well. But some of my patients have asked me about it, and I defer because I'm a chiropractor. We don't prescribe these type of peptides in our practice or medications. But I wanted to share with the audience some information out there that they might go investigate and find someone. So if somebody is interested in learning about peptides, what should they do? Should they go to their family practitioner? How do you find someone that does recommend these type of products?
I would say that traditional, conventional physicians, from one point of view, they don't know much about it, probably because they're not, I cannot say they prohibit it, but they are not allowed to use them. I can give you an example. My son had a surgery for the ruptured of anterior cruciate ligament.
Oh, wow, in the knee.
The knee. And when I asked the orthopedic surgeon, I said, listen, doctor, I don't want right hand not to know what left hand does. So what do you think about BPC-157? Should I start it with my son prior to surgery so he heals faster and better? He said, I don't know anything about this stuff. The only thing I know that I have a couple of patients who use them, and they healed miraculously well and fast.
Okay.
So usually it's a functional medicine physician. Some, I would say, orthopedists and some pain management doctors who has like open mind.
Okay.
And who actually try to help the patients with all available armamentarium.
Right.
Without restrictions.
Right, and the idea of the provider being a medical doctor is good, because there might be people out there that shouldn't take certain peptides because maybe they take certain medications or they have some conditions that it might not be as good for them. I would think maybe it's not right for everyone. So if you have a medical provider that has a background and some training with this, they're more able to guide a patient under better supervision to make sure that the patient gets a result and it's also safe.
Well, obviously, you need to when you use such a potent stuff that is working on a level of the cellular mechanisms, you need to consult the physicians because that is experience. Because, for example, the peptide, some peptide like the same BPC-157, what it does, it increases the cell replication. Is it good for the injury? Yes, it's excellent for the injury. What I'm afraid of is the people who may have some kind of an undiagnosed cancer. And it will promote the growth of cancer tissue together with the growth of the, let's say, ligament or tendon or fascia or something like that. So you always, in medicine, you're a physician. In medicine, is never anything simple.
Right.
Even if you give somebody a Tylenol.
Right. There's always a risk. And that's why I think, like what I was just saying, it's important to make sure that you're going to a provider that has training in this and understands the patient from different aspects and understands their health history, medications, contraindications, and all that, so it's safe. And I listened to a video online on YouTube about peptides, and this one doctor described these peptides like an app on your phone. And if there's so many different apps on a smartphone, each app could be like a peptide. It can do something and help turn something on or off, help with skin to be appear healthier, to be able to sleep better. I think there's some that help improve cognitive function. I've heard, because we treat patients that have had concussions and trauma, that there is a nasal nasal spray
Selank.
that is CMAX.
CMAX and Selank.
Yeah, that can be helpful for people that have had a TBI in helping them recover more effectively. So, and I think that was actually developed by someone in Russia, actually, the nasal spray for that particular peptide, some research from there. But it's just interesting that there's all these different peptides that can help people differently. What are the most common reasons why people usually come to your office? You do functional medicine, that they come to your office for peptide consultation?
Well, a lot of people don't want to use the medicines because there is a very interesting guy in the Institute of Functional Medicine. It's Bob Roundtree. Wonderful guy, incredible lecturer. He says the natural medicine, the herbal medicines or some supplements and whatever, they, in contrast with medication has one action and 20 side effects. But the medicine that is derived from the natural sources, a lot of them, peptides included, peptides especially because they're very ubiquitous. They have many effects but no side effects. We probably don't know yet the full spectrum of action of any peptide. We know just the most obvious action. But they're very ubiquitous, like hormones. When you're speaking about hormones, you give one hormone, it has 100 actions on the body.
Right.
One that is very prominent and the other ones that are not that visible.
Right.
So I think that with peptides, we're just beginning to study them, and because studies are not well funded, it is not that a large amount of scientific literature recently, for example, about BPC-157. By chance, I found my friend suffers with very severe glaucoma, and he said, listen, do you have anything? And it's a close friend, so I sat down with medical literature, and I found one study that says that BPC-157 is amazingly healing for the eyes, that it lowers the intraocular pressure, that it restores the optic nerve and the circulation in the eye and arterial injuries. It's amazing. So who could have thought that the main peptide that is given to patients for musculoskeletal the injuries or conditions would have the action healing for the eyes. That's what my point is, that we are just beginning to know the full spectrum of actions, and probably will never find everything.
Right.
But they are amazingly effective molecules, signaling molecules that is very effective for treating multiple conditions.
Right. Now, do you think that this is becoming, these are more effective in people that are a little bit older because maybe there's less of these peptides present in the person's body, and as we age, maybe some of these natural substances decrease, or is it because we're not getting the right nutrition? Why do you think that they're so effective if they're naturally occurring?
Well, because when we give peptide, we don't alter the natural processes in the body. We actually support the body function of self-repair.
Okay.
So we kind of help the body to do its job.
Do you think it's peptides are more like a higher level supplement, that when people take vitamins, let's say they take fish oil, they take vitamin D3, they take folic acid or other things, do you think that these peptides are similar, that they maybe bridge the gap between what we're lacking, and when we have those proper building blocks in the body, that we're able to function at a better level? Do you think that's maybe the theory or rationale behind them?
I think that we're more accentuating the body's own abilities.
Okay.
Because we need to determine what's a supplement.
Okay.
Is hormone a supplement?
Well, yeah, that absolutely. I always looked at supplements as being, let's say somebody doesn't get enough greens in their diet. They don't eat enough kale. They don't eat broccoli. They don't have salad, stuff like that. So there might be certain vitamins they can take that they can get some of that nutrition so they don't become deficient in those areas, and their body will function better. But with peptides, we might have them, but then we add a little bit more, and then the body now can function or do things more effectively. So there's a couple of that I wrote down here to see if you're familiar with these. KPV in helping decrease inflammation in the gut and the skin and so forth. Have you?
KPV. Frankly, let me remind myself. I'm not sure that it's one of those that we're using.
And the CMAX.
CMAX and wait a minute, CMAX and I just was talking about it with you. CMAX and what was the one I was just talking about with you?
BPC.
No, not BPC-157. CMAX
and
Selank.
Selank. Okay.
Those are mostly working on the cognitive
function, yeah.
Cognitive function, increasing the nerve factors and increasing the circulation of the brain, restoring there is another way, is difexa, I think, difexa, something like that.
Okay.
Those are three for the ones that are working on the brain.
Okay.
Very effective in building new dendrites, which is the input input points of the nerve cell.
Okay.
So it is very helpful when somebody learns some new stuff. It increases the ability to remember new stuff.
Okay.
So such a particular action.
Right, right. The details. What about like for energy? I heard people take some maybe to increase their energy. Any peptides that you've encountered that can help with that?
Well, there is a peptide named MOT-C, which works in a mitochondria to increase the efficiency of the energy production and the
So you can make more ATP.
generation of electricity in a cell.
So like you can make more ATP. So you can you can have that, great.
Of course, you need to have all these substances like vitamins B group, BAT plus, CoQ10 to support the chemical reaction. But this MOT-C promotes the formation of the electrical charges on a membrane. So it makes it more effective.
Okay. Now, I'm going to ask you about one area that it's very, very on the top of minds of a lot of Americans probably because of our diet and our inactivity. That might have something to do with it. But weight loss. Are there peptides that people have taken to help with weight loss?
They are. I don't need to talk about. I think everybody above 20 knows about this GLP-1s.
Yeah.
And tirzepatide and these new ones, the triple action one that just came out. They are good, but again, I don't think that they are good for people who want to drop 10 pounds. I think they are so potent and they are so deeply effective that you're practically using artillery against the mosquitoes.
Okay, so it might be overkill.
Absolutely. I have a patient who was coming to me and he had, I think he was over 450 pounds. I think he was 458 pounds.
Oh my God. Okay.
Okay. He started to use this tirzepatide, and he dropped now to 348.
Wow.
100 pounds.
Wow.
And I would say, don't stop, continue, because he is a case where it's a life-saving.
Right. Because the risk of heart attack, stroke.
Extremely effective.
Wow. Yeah. So like. Some of the weight loss drugs, like Mounjaro and Eli Lilly, tirzepatide, are widely being used. So many people are using them right now, and I think that people are learning more about peptides.
Oh, don't forget about this GLP-1s. You as a chiropractic physician. What's the better way to treat the low back pain than the weight loss?
Yeah, weight loss is...
or knees.
Yeah, and knee pain, extremity pain. Weight loss is a big... I mean, being overweight is a contributory factor to back pain, to knee pain, hip pain, foot and ankle pain. Of course, it's more stress, wear and tear on the joints, absolutely. So I agree with that. But you think that they're, in your experience, maybe too potent. Can people take less of a dosage if they wanted to?
Yeah, you can microdose, but again, in medicine, you always need to see one thing: the risk versus benefit.
Right. Okay.
These peptides, they do have some side effects like a gastroparesis or they raise pancreatic enzymes for some reason. They cause sometimes pancreatitis, but in some patients it's just increase the enzymes, so there is some kind of a reaction on the pancreatic side.
Right.
Okay, but again, you need to always consider what's a benefit to risk ratio.
That is, Doc, a great point that you brought up, and why it would be important to have a medical doctor supervising and making sure that when people, if they're looking for these more natural ways to help themselves, that they are under the supervision of a medical doctor, because if not, it could be dangerous. So that's a very good point. What about, so how do people typically take these peptides? Are they injected all the time? Are there creams? We talked before about one that's nasal for the cognitive function, CMAX. How are they mostly administered by patients?
Well, there are several ways to do it. First of all, it's injections.
Mm-hmm.
Okay. There is an oral form, some peptides. Like, for example, BPC-157 is a gastric peptide. It's a specific peptide that's produced in stomach of the animals to protect the stomach from, to support the restorative ability of the gastric inner lining. Because
Great.
what stomach is mainly a bag with the acid.
Mm-hmm.
So it's a lot of dying cells there in the mucosa, in the gastric mucosa, because it's an acid.
Mm-hmm.
So this is why the BPC-157 restoring
that lining.
restoring that lining and protecting this lining.
Mm-hmm.
But it actually is a gastric peptide. So BPC-157 could be formulated in capsules because it actually, gastric peptide is not destroyed by gastric acid. And the other peptides, they are injected. These names, I always forget.
Some of them are
GHQ something.
GHKQ. Okay.
Yes, that's a peptide with a group of copper.
Okay, yeah. Is it for the skin?
It's it has restorative action on the skin in addition to the other functions. So you can actually, of course, if you deliver it directly to the skin in a good formulation that could be absorbed by the skin cells, of course, it's a signaling molecule. The signal will get through.
Right.
And the nasal sprays, first of all, peptides are absorbed by mucosa.
Mm-hmm.
But again, the nose is the shortest point to go through to the brain.
Right.
So nasal application, like, for example, oxytocin, the hormone of love.
Yes, yes.
Okay, so you can formulate it in nasal spray, and it's very effective.
Wow.
Other than, for example, in the shots.
Okay. And I heard that GHK CQ, it actually can help with hair growth.
Right.
Wow. Like on my head, you think I have a chance of I don't know. Maybe. But you know,
I mean, according to YouTube advertising, yes.
Yes.
Just pay the money.
Yeah, that's funny. Or it would be bad if somebody was taking it if a woman was taking it, and that could be a side effect. They can grow a lot more hair on their face or something like that, and they didn't want that. So that's why, again,
I don't think GHK would grow their facial hair.
Okay.
Because it's hormone related.
Okay. All right. Just checking. That's why I'm not.
Their hair, if they apply it to the hair,
then maybe.
it increases the volume of the hair and restores
Yeah.
this shining quality,
Yeah, I mean, and listen, it's probably a lot less side effects than taking that than maybe some other drugs out there that are for hair loss. There's a lot of medications, and people go through surgeries for that.
I love when they use finasteride to protect the hair, and finasteride is famous for causing the irreversible or near irreversible impotence.
Yeah,
So why would you grow hair?
yeah, exactly. And then
You don't need
you're
contract anymore.
and then you're impotent. So yeah, it's crazy. But
So definitely, I would choose GHKCQ.
yeah, it seems like it would be a safer alternative. So any misconceptions that people have about peptides?
People don't understand what peptides are. And they say, "Do you do peptides?" Dr. Berman. I say, "Do you do medicine?"
Right.
Yes, I use peptides in my medical practice. But I'm one of the group of doctors who learned about peptides many years ago, and we're using it in order to achieve certain results.
Great.
But you need to know what the person's problem is to say, hey, listen, yes, there is a way to use peptides with you, but it's not like vitamin C that it's good for you.
It's good for everyone, right? Yeah, and let's go into that a little bit. What makes you a healthcare provider, a physician, different than other providers? Let's go into your training and background a little bit with functional medicine.
Well, I actually was trained in my native country. My father was a very famous urologist, like a scientist, a very highly specialized guy. He was treating and operating testicular tumors.
Wow.
Have 2 dissertations, 2 PhDs on that level. So I was trained as a urologist. But to say you honestly, I sucked at surgery. I didn't suck at surgery. I was very, how do you call it? I did not have that surgical confidence, I was
It's
worried.
a different skill set. It's a different skill set.
I was worried after surgery. What if I forget something? What if I did something wrong? So when I came to the United States, I did family medicine for about 20 years. And then I was so disillusioned with these changes, with all these insurance changes and stuff like that, because I like to treat people. I don't like to do billing and think of billing first. So I always was interested in endocrinology. So since 2006, I actually was doing the hormone replacement therapy exclusively since 2007. And as a part of this functional medicine education, these cell societies, IFM, A4M, AMG, everything that new, it's a new specialty, functional medicine. So everything new that coming in the line, we're very hungry for that because we want to help patients. And I heard a lecture first in 2000, probably 13, 15, about the peptides, and I was very enthused with that. So I tried BPC-157 on my wife first because she has a back pain, and I don't like. I practically used everything on myself to try.
Okay.
If I'm not hurting somebody, or I'm very much afraid to charge somebody money, and for them to be dissatisfied. I try to pick the patients who will be successful.
Right.
So I get my wife this BPC-157. For 2 weeks, she didn't feel any difference. And then when I asked her 2 weeks about it, after starting BPC-157, I said, how's your back? And she looked at me with her eyes. My wife is Japanese. Her eyes was absolutely round. And she said, oh, I don't have it. So I say, okay. And I started to use peptide one after the other. I use BPC-157. I use Selank on some people with dementia. I use TB500 in combination with BPC-157, some others. It depends on the case.
Yeah, exactly.
But I always have in mind that, hey, listen, if you have this kind of condition, you know what I also used pretty much was this bremelanotide, PT-141, that gives you the tan. I have a friend with a vitiligo.
Okay.
You know, this white spot. And we kind of made a cream for him.
And it helped?
It helped. Also, I had one friend who is very, very fair, and he cannot come out of the sun completely. I mean, he burns immediately.
Like me.
And we gave them this little bremelanotide in the shots, and he darkened a bit. And after that, he started to go more on the sun, and now he pretty tanned guy. He's not burning anymore.
That's so interesting.
But take it. This is another point to my previous point, that they are very they have many different functions. The same bremelanotide that we use to treat this fairness condition or to get the people tan.
Right.
If you use it through the nasal spray, it affects the brain and it increases libido.
Oh, wow.
It actually went through the
FDA.
And they made a medication out of it, which costs, I don't know, $1,200, $1,500 for very little supply.
Wow.
Okay? Specifically with the indication of a female sexual arousal disorder.
Wow. This is so much.
Take the color of the skin with the sexual.
Yeah, it's just so many different applications of areas that it can affect the body. But for our listeners here, I wanted to shed light on something that people can investigate. That if they are injured and they feel that they want to do something natural, and they don't want to take a lot of medications. They don't want to take painkillers, and they can possibly investigate this with someone that has experience in functional medicine, like what we talked about.
Probably will be the safest way to help them not only to control the pain but also to regenerate their tissues. They checked how much BPC-157 is needed to kill the animal. You know, this lethal dose 50.
Right.
They found out that I think it's something like 25 grams or 125 grams of BPC-157. And we're using 200 300 micrograms.
Right, so much less.
It's a quarter of a milligram.
Right. Wow.
So it's millions of times less that could cause
death or fatality. Yeah. So if somebody is out there and they live in South Florida and they're looking to investigate peptides, how can they reach you? How could patients learn more?
Our website is Youth and Longevity. And I have another website, Hormone Correction.
And we'll put this in the show notes in the episode.
And my office is in Palm Beach Gardens. I'm doing this stuff for a long, long time. I started in 2007, as I said. And I have a book out, by the way.
Oh, great.
Actually, I have it for you in my car.
Okay, great. That'll be great. I'm always wanting to learn more about ways to help people and also finding different providers that people can see, helping people the least evasive way possible. Because if people could do something instead of surgery with less possible risks and complications, then that's usually going to be the better way for them to do. And that's what really most people want.
Yeah,
So,
my father was a very wise physician. And he always said, you always have to go from more conservative treatment towards more radical. He said, surgery is always surgery.
mhm.
So the good surgeon is the one who can avoid the surgery.
Right, absolutely. So I want to thank you for coming on the show. And we have a little ritual at the end of the show.
I was afraid about.
Yeah. Oh, don't worry, don't worry. And what we do is we have these tumblers, these cups over here, and they're superheroes. And what they signify, or what they represent, is a comeback resiliency. A lot of the people that listen and watch our podcast are trying to overcome an injury, and we like to give our guests a kind of a souvenir, a token that represents that comeback spirit. So we have several different ones right here. We have the Hulk, we have Deadpool, Thor, Batman, Superman, and we have Wonder Woman. Out of those, which one speaks to you the most? Which one do you like?
I have a confession to make.
Okay.
When I came to the United States, I was so busy getting my exams passed and everything, so I actually never saw any one movie or any one book.
Oh my gosh.
That's what I was going to talk to you. I forgot before the show.
Okay. All right. All right.
But I do appreciate it.
Yes. Yes. Well, we appreciate you coming in. And for those of you out there, peptides might be helpful. Check with a doctor that has training about this type of therapy. It might be helpful for you. And again, thank you so much for listening and watching today. And again, like, follow, subscribe. See you on the other side.
Thank you.